Hi, I'm Gabriela Kalkmann, and I will present peritoneal catheter spontaneous extrusion through the intact abdominal wall, report of 2 cases. This study was guided by the Dr. Carlos Humberto and we from Brazil. The ventriculoperitoneal shunt is a neurosurgical intervention widely used in the control and the treatment of hydrocephalus. This procedure can cause some complications like infections or subdural hematoma. The migration and extrusion of the peritoneal catheter through the intact abdominal wall has been considered a hard complication in surgery to treat hydrocephalus. Prophylactic measures can be considered in preventing this complication. 2 cases of peritoneal catheter extrusion through the intact abdominal wall are reported in patients with congenital hydrocephalus. In the first case, Neil is about newborn male with 6 months old. He underwent VPS 4 months ago due to congenital hydrocephalus. He was admitted to the pediatric emergency service in a poor general condition, febrile associated with the presence of an erythematous lesion close to the umbilical scar with spontaneous drainage of purulent secretion, prominent anterior fontanelle, presence of the distal portion of the catheter through the abdominal wall. The VPS was removed and started systematic antibiotic therapy. The bacterioscopy of purulent secretion presented negative culture. After 7 days of antibiotic treatment, the new VPS system with medium pressure valve was installed. He was discharged from hospital with normotensive fontanelles and improved general condition. The family was orientated for outpatient follow-up. In the second case is about newborn male, 4 months old. He was admitted to VPS 3 months ago due to congenital hydrocephalus. He entered the emergency room in a very poor general condition. He was feverish and malnourished. He had inflammatory signs in the abdominal wall associated with extrusion of the peritoneal catheter. He was admitted to systematic antibiotic therapy and removed from the system. Being admitted to an external ventricular drain. After 8 days, he was admitted to a new VPS on the opposite side. He was discharged from hospital after 12 days with a well function and without fever. The both patients underwent shunt system removal with administration of systematic antibiotic therapy, followed by replacement of a new shunt with excellent results. In the conclusions, the presence of complications, surgical treatment is indicated through complete removal of the system, systematic antibiotic therapy, and subsequent replacement of a new system. Thank you.